Welcome to Medgate Today podcast, where business meets innovation in the world of healthcare. From medtech to pharmaceuticals, diagnostics, and medical devices, we bring you the latest insights from the leaders driving the industry's evolution. This is me, Hera Ahmad, your host. We are absolutely delighted to welcome you all to our series called A Healing Edge Story Behind the Stethoscope. And today, we are thrilled to have a visionary in the healthcare sector whose out of the box thinking is shaping the future. Please join me in welcoming Dr. Tanvi Chawla, who is a Delhi NCR based prosthodontist with over a decade of experience. She holds an MDS in prosthodontics and Crown Bridge alongside India's first masters in medical technology from AIIMS-IIT. Since 2011, she's been delivering advanced dental care in Gurgaon, specializing in virtual surgical planning, 3D printing, and tissue banking. Known for her melding precision tech with compassionate care, her army family background enriches her empathy and cultural insights. In her downtime, she's on the golf course, pursuing another field of excellence. Hello and welcome to the show, ma'am.
Thank you, Hera. Thank you for having me on the show. I was very eager to, join this conversation on medical technology and innovation.
So, ma'am, can you give us a brief introduction about yourself?
So, as you already said, I did my master's in prosthodontics in 2014. Then after that, I practiced dentistry. And then I did my second master's in medical technologies from AIIMS and IIT Jodhpur. It was a collaborative program. So after that, I was doing a program called as iInduct with GDC IIT Madras. And after that, I'm into 3D printing, virtual surgical planning, and now tissue banking.
So, doctor, what's the story behind your stethoscope, the personal journey, the defining moments, and the healing edge that shaped you as a doctor that you are today?
So yeah, it was a long journey, I would say. I completed my master's in prosthodontics, and then I was practicing until the COVID happened. And at that point of time, I realized the technology was growing so fast. You cannot grow without growing with technology. So I came across this course. I was trying few things, but I was failing in that. It was not that I was, immediately successful. So I came across this course in IIT and AIIMS Jodhpur. I applied for that. I got selected. And then, that thing changed my life. So it was a regular course. It was like I was into college, which was like going to college after so long is also, very interesting. But yeah, it was difficult for me as well to, start from the scratch and getting into a new thing. Technology became the main part and dentistry was, left behind. But now I'm merging both of it. So yes. So now I'm into virtual surgical planning and patient-specific implants. And recently I've done this tissue banking course from Ramaiah University. So this was all my journey throughout.
So, ma'am, can you briefly explain what virtual surgical planning and 3D printing mean in the context of modern surgery?
So, what is virtual surgical planning? So, as you can see, surgical planning, we are, planning the surgery on a, virtual platform. That is, on a software, we are planning the surgery. We can call it, we are doing a mock surgery. Like we play video game. How do you do it? You can get another life in a video game. So while you perform a surgery on a software, you can, try different approaches. A biomedical engineer and a surgeon sit together and they do the surgical planning.
Demo sort of a thing.
You can call it a demo, but not exactly. You can try the different approaches, like this can be done because while you are operating, you have to have one approach only. But during the mock surgery, you can try different approaches. There are different ways you can try. So you can do that. Plus, what we do is how 3D print is related to this is we for a cancer patient, if I would say. There is a long bone, there is bone loss. So we have to, pick up bone from one part of the body and we have to, put it on the other part. So here we can see an angulation for a oral cancer patient. We see an angle and this bone is straight. So we do the cutting where is done on the software and the exact cuts are planned we make surgical guides and jigs, like we give you the stencil, kind of a stencil, which we 3D print, and those surgical jigs and guides goes to the for autoclaving, like sterilization. We sterilize them, and then those are used in the operation theater, ORs. So in the OR, while performing the surgery, the doctor is making the exact cut where that was planned on the software. So the surgery become very precise. The time taken to perform the surgery become very less. So this is how technology is improving the patient care.
So ma'am, what are the materials used in this technology, and how do you ensure patient safety?
So if I talk about patient-specific implants, like in a neurosurgery case, like where we have to replace a cranial vault, so we use medical grade titanium, which is biocompatible material. Patient safety is utmost for us, because the material has to be biocompatible. And for jigs and guides, we use biocompatible polymers and resins, which can be used in OR for a certain period of time. So everything is biocompatible.
So ma'am, what are the biggest challenges you are facing when implanting these technologies in clinical practice?
So Hera, there are a lot of challenges, if I would say, because the technology is very new. First of all, there is a learning curve. So it is not that while you switch your phone from Apple to Android, or Android to Apple, you have to have some learning in it. So features are not the same. You have to adapt, and once you start using it, you get used to it. And but that happens eventually once you start using it. The challenge is that doctors need to adapt this technology, adopt and adapt to. They need to use it in the routine practice. In the next 5 years, you will be seeing it will be no surprise that every big hospital will have their own 3D printing
We can
lab.
take example of smartphones. Like
yeah, right.
When it came, people started using it as something like a very premier thing. Only a few people can use, or good with technology people. But now everybody is using
it. So this is how this comes with. But there is a learning curve. You need to learn that technology. You need to understand the tools, the components of it, and practice it with another case, because it's not like a mobile phone. You're using it every day. And so one is this. Second is the cost part. The cost related to it, which is eventually is coming down. Like earlier, like implants were expensive. Now the standard implants are into routine procedures. The patient-specific implants will also come into routine procedures now. So cost and learning curve are one of the biggest challenge, and adoption to the technology. I think old clinicians are very resistant to it, but I think the new generation is quite adaptive to this technology.
The conservative thought process, if you say.
Right.
So where do you see this technology heading in the next 5 to 10 years? Are there any upcoming breakthroughs we should watch for?
Yeah, the future is very, very promising, I would say, because if we see the patient care, we are cutting down on the time. We are making the surgery very precise. So 3D printing is a game changer. Like if I'll tell you about a patient walks in and we give the patient an MRI or a CT, but patient is not able to read the MRI and its CT. But if I give patient a 3D printed model, this is where your disease is, or the cancer model, if I show them, this big is the disease. So patient will have faith on you, and
they'll be able to understand
better. And in fact, this helps doctor also to visualize it, outside the board. But we cannot visualize it. There is a limitation to visualize it on the while you see the MRI and CT. But 3D printed models are easy, give you a perfect visualization, and you can do a lot of things with the model. You can play with it.
So what are patient specific implants?
Okay, interesting. So patient-specific implants is like, I'll give you an example. You go and buy a shirt. You know, those are like standard implants. You see like it's fitting. Oh, this is my size. This will fit me. But patient-specific implants is like a tailored suit. That is made according to the patient's anatomy. We take patient CT or MRI and we 3D print the metal implant according to the patient. The fit is very precise. That if you see, a tailored suit is very gives you a very
Personalized
good fit.
and
Personalized
customized.
medicine. Basically, that's related to the same particular patient only.
So, for young professionals or medical students listening, what skills or knowledge should they start developing to work in this space?
If I were of their age now, I would, integrate technology as soon as possible. Like I would learn, if I'm a medical or a dental student, I would learn coding or maybe any of the technology side by side, so that, and the most importantly, we should collaborate. So if you are a doctor, you should talk to your engineer friends. If you are an engineer, you should talk to your doctor friends, and you should talk and discuss ideas and collaborate basically.
The medical and technological collaboration.
Yes,
The medtech term.
Medtech term, yeah, exactly.
So, how do you balance clinical precision with patient comfort and trust?
See, patient trust comes with, with his experience throughout the treatment. So how 3D printing is affecting it? If I give you a disease model to you, this was your disease model. Now you are okay. This is how you are now. Or in fact, after the treatment, patient feels like, how the technology helped patient. Nowadays, if I give you a 3D printed view of your disease, like which you can see on your mobile phone, like you can see, like this is how my inside looks, not the CT scan or MRI, but a 3D printed view, animated view. So this is how patient trust can be built with 3D printed technology, and also with like for example, a neurosurgery case or a trauma case, where initially they used to use bone cement and do the, now with the software you can, if you have to mirror, exactly print the same part, you can mirror it on the software and do the exact building of the cranial vault, which I would say is very, very cosmetic than the normal procedure which we used to do it earlier.
And the healing process
is faster, of course. When the OT time decreases, healing time is faster.
So, as a woman in the specialized dental field, what has been your journey in terms of leadership and recognition?
When I was doing the regular dentistry, it was like a routine thing for me, and I was not settled with that. So I wanted to do something more to it. I wanted to add something to it, which led me to do another master's. And initially there were a lot of challenges, like I was asked questions, what after this? Why are you leaving that? Or what is the, why are you doing this? Since you are already a specialist. At that point of time, I was very much convinced, but others were not convinced. So I think it was totally worth it, and
you had to take the risk.
Yeah, and I'm here now.
Definitely. So, coming towards the dental care segment, where do you see the future of dental care in India leading in the next 5 to 10 years?
Dental technology, if I talk in terms of 3D printing and technology separately, so technology wise, earlier we used to take impressions with a material, we used to pour material and we mix it with water, and now everything is becoming digital. We have scanners now, we just scan it and it is like 5 to 10 minutes, not even 5 to 10 minutes procedure, and you are done with your all the dental scans, and you can keep the patient record. You don't have to have those solid models. You have to it was a tedious process. The process has become very easier now and technology driven, and 3D printing has a major role in dentistry. Like, you must have, braces are going outdated now, aligners have come, so all the aligners are 3D printed. That those chira and kata we used to do, now the entire process is gone. We are placing implants in the guided surgery. We print the guide and we use a tissue punch, and there is no chira and taka now.
There is no marks or anything.
No. We just use a tissue punch, we put the implant, and the thing is done. So this is how 3D printed is a game changer in dentistry.
So ma'am, one more last question before we end. What is the one guru mantra which you use in your clinical practice every day?
There's no guru mantra, I would say. I mean, it's just keep. Guru mantra, I won't say. I love Nike. So the Nike, why I love Nike is like, just do it. So morning I wear my shoes and I just remember that, just do it. So that's my mantra for myself, and that's it.
So ma'am, thank you ma'am for sharing your valuable time and insights with us. Thank you viewers. So that was Dr. Tanvi Chawla for us, who is doing wonders in the field of healthcare. Thank you.
Thank you, Hera.